Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement.
And I'm your host, Leigh Dill, and today I'm joined with Paul Malley, president of 5 Wishes. And 5 Wishes is an innovative employee benefit that integrates end-of-life planning into workplace healthcare offerings. And today we're talking about what can be a difficult topic, which is caregiving and aging parents, aging loved ones, and the impact that taking care of loved ones can be in the workplace. Paul, thank you so much for joining us today.
Thank you, Leigh. It's great to be with you. I appreciate it.
Yeah. And so we'll just jump right in and look at some of the statistics that you've got on your website. And it talks about the impact of caregivers in the workplace and how much time they take away from work and what the impact could be on their productivity in the office place. So you've got 61% of caregivers experience at least one change in their employment due to caregiving, such as cutting back work hours, taking a leave of absence, receiving a warning about performance or attendance. 49% of caregivers arrive to their workplace late or leave early. 15% take a leave of absence. 14% reduce their hours or take a demotion. And 6% give up working entirely. That's a problem that employers have to look at to keep their employees productive and in the workplace and give them the tools they need to feel supported. Paul, tell me a little bit about 5 Wishes and what y'all are doing to help combat this problem.
Sure. And I think for your listeners, those numbers, they're big, but they're not really surprising, right? They come from the Rosalind Carter Institute of Caregiving that does a lot of national research on the challenges that caregivers experience. And this points out that there are challenges in the workplace. And, at the end of the day, I think one of the most important things that we have to realize is that we're hardwired to take good care of the people we love. It's our basic human instinct, whether it's taking care of our children, taking care of loved ones who are sick, it's what we want to do. And when there's a crisis or a serious illness, then it's kind of all hands on deck, right? Everything else that's important in life sometimes has to stop so that we can focus on that thing that seems most important, and that's taking good care of the person who we love. Now, where 5 Wishes and Aging with Dignity come in, we're a national nonprofit organization, and we realized that one of the biggest challenges was not just navigating the logistics of caregiving, but really what happens when there is no plan, when families don't know who a decision maker is if their loved one can't speak for themselves anymore. And then it's a scramble. Sometimes families are divided about which of the adult children should be the decision maker for mom or dad. And in almost all of these cases, everyone is well-meaning. They're wanting to do the right thing, but they just don't know what the right thing is. And that's where 5 Wishes comes in. It's been used around the country. More than 40 million people have used it. And it's a simple way to use a legal document to make decisions ahead of time so your loved ones don't have to guess what you would have wanted. And now employers across the country are providing it as an employee benefit to make this process easy for their employees to kind of relieve that caregiving burden. Doesn't take all of the challenges away, but it relieves that biggest challenge of the uncertainty and disagreement that is unnecessary so that you can really focus on the heart and soul of what matters the most, and that is taking good care of the person who you love.
Wow, relieving the challenge of uncertainty. What a troublesome burden that can be on some people. I want to go back to what the member journey looks like in just a minute. But first, your company was influenced by Mother Teresa. And I think that is so amazing. Tell me a little bit about the history of how 5 Wishes came into being.
So our founder, Jim Toohey, is an attorney, and he met Mother Teresa in Calcutta. He was working for a U.S. senator at the time, and Mother Teresa said to him, "I want you to visit my home for the dying." So he did that the next day that he was in Calcutta. And rather than walking in and being given a tour, he was put to work. One of the sisters asked him to take care of the man who had just been brought in off the street, who was likely in the last hours of his life. And that experience at the bedside of that man changed his life. He came back to the States, quit his job working with the U.S. Senator, went to live as a full-time live-in volunteer at Mother Teresa's home in Washington, D.C., called the Gift of Peace, where he was with, at the time, this was in the 1980s, men who had just been diagnosed with AIDS. That was the front line of this house that was providing caregiving, where he lived for a year. And, what he saw there was not all that dissimilar from what you would see at any bedside of what people wanted. They wanted to be loved, to be known by name, to have their hand held, to be prayed with, to have their pain managed, to not be in pain, to have their basic human dignity respected. And that means being kept clean and warm and, the basics. And it's a similar thing in our own homes and in nursing homes around the country. People want to be known and to be loved. And that's part of the inspiration of 5 Wishes and Aging with Dignity, is helping all of us to take good care of the people we love when they need us the most, giving us the practical examples from a legal perspective, designating the person we trust to make decisions for us, giving instructions about the types of medical treatment that we'd want or not want, and then just giving basic instructions about here's what it means to take good care of me, and here's who I'd like to have with me, and even music that I'd like to have played. Sometimes people write in 5 Wishes, list of certain music that they like, and some people would write, you can play anything, but I don't want to hear harp music. I've heard people say that. And real personal preferences that, for me personally, I use 5 Wishes with my parents. My mom passed away just a couple of years ago and had hospice care. And the answers that she gave in her 5 Wishes were just so valuable to us as me and my brothers were in the house caring for my mom with my dad. And we just wanted to do what she wanted. And we were able to do that and cook the food that she wanted. And the house smelled the way that she wanted it to smell. And she wanted to have her nails done. So for a mom with 3 sons, she had the best looking nails that any mom could have, that 3 sons could pull off. And those were the types of things we knew because we had talked about 5 Wishes with her.
Wow, that's awesome. I love that story and how heartwarming it is to be able to give things that you wouldn't know were wanted in the last hours or days of life. Let's walk through what this looks like. So you said Jim was a lawyer. He met Mother Teresa and created this document. So where does this document, how was it filled out? And where does it live? So it's available in all 52 states, or what would you call it? It's used by law in all 52 states.
It does. It meets the legal requirements in all states. We worked with the American Bar Association when we first introduced 5 Wishes. It was a national program funded by the Robert Wood Johnson Foundation out of Princeton, New Jersey. And we were grateful to work with the American Bar Association that helped us to look at all the legal requirements in all the states for an advance directive, for a durable power of attorney for healthcare and living will. So 5 Wishes is written as a kind of a super form that meets the legal requirements in all of those states. There are 4 states that have some extra hurdles to jump over and some specific language in Texas, Ohio, Kansas, and New Hampshire. And the instructions are included in 5 Wishes on what you need to do in those states. But the idea was, yes, we could make it simple for everyone, every adult, to fill out this legal document that is a right that is given to every person, every adult, to make decisions ahead of time before a serious illness, while you can make decisions for yourself. So that if something comes up, if there's a terminal illness, or if you're in a car accident, or something happens unexpected, that decisions that are made about you would be guided by your wishes and your intention as expressed in this legal document. So when we introduced it, we thought if it could help a handful of people, that would be great. And the demand for it just skyrocketed. Millions of requests from all around the country, from individuals and families, and then healthcare providers. Then we started hearing from businesses, employers. Oftentimes it was because somebody used it in their own family and they wanted to bring it to work and share it with their caregivers. And they said, this was helpful to our family, so I'm sharing it with you. It's better than bringing a box of donuts to work, right? But it's part of the same idea. This is something I want to do because I think it would be helpful to you. And that's how employers started to use it. And then, we worked with small employers that had 10 employees and others that had thousands of employees. So we've been really grateful and happy to see the impact in businesses and with employers that have provided 5 Wishes to employees with the simple message that says, we care about you and your family, and we want to make caregiving a little bit easier for you. And here's a resource that you can use.
Okay, I'm glad you brought us back to the employers because that's the majority of our audience. And while we're here today, let's walk through what does it look like to work with your team, and when is the best time? Because talking about death is never an easy subject. So when is the best time to introduce your solution into an employee group?
Sure. So several different opportunities. Some employers include it as part of their open enrollment when they're talking about selection of benefits each year. Some will make it part of their new hire onboarding when they're informed about health insurance selections and options. They might also learn about 5 Wishes and be given a copy of their 5 Wishes. On the logistics side, there are 2 different options for the employer. They can either provide hard copies of this document that's provided in a folder that has 2 5 Wishes, so the employee can use it for themselves and then a close family member, a spouse or a parent or someone else close to them, and then a family conversation guide. So that comes in a folder. Those are $10. So this is a very low cost employee benefit to offer because you're only providing the resource. Mm-hmm. There's not a recurring membership. There's not a recurring fee. There's nothing that the employee has to pay. So it's pretty simple and pretty inexpensive too per employee. So you can provide that folder to them in a hard copy format, or there's also a digital option. So that's helpful, especially for employers that have people scattered around or maybe working remotely who don't all come together in one spot. It can all be done digitally through a link as well.
And someone fills it out. They give it back to their HR, their manager, their HR director. Where does it live? And how, if, something tragic happens to me, how does my family know that this document exists?
That's a great question because, one of the concerns that we had from HR professionals was that they were worried about being involved in something this personal mm-hmm. in an employee's life. And so they were wondering, do they have to give 5 Wishes back to us? And what is our role as an HR professional? And the answer is that your role is simply to provide the resource to them. And in 5 Wishes, all the instructions are included, including instructions on what to do after you've completed 5 Wishes. They don't need to give it back to their employer. They should give a copy to their family members and the people who they name as a healthcare agent or a decision maker. And then they should bring it to their doctor on their next doctor's visit and ask that it be included in their medical record. Every 5 Wishes that we provide also has our website and a toll-free phone number on the back so that if people have questions, they don't have to go back to their employer to ask it. They can call us directly. So what that means is that the employer's role is really pretty simple. It's providing a resource that is helpful to people, but that what we know from research and even in employer settings is that people say, yes, I think advanced care planning is a good idea. I see why it's important. I have no idea how to do it or who to ask for help, especially people who might not have their own personal attorney. So that's the benefit where an employer is providing this to their employee and their family. It's saying, here's something that's useful to you. We're going to provide it so that you don't have to do the research and look all over and find a provider and pay a professional. You have the resources because you're an employee and we care about you.
That's great. So what are some of the benefits that employees gain by using 5 Wishes?
So I think part of it is conveying that that interest in their personal well-being, right? For an employer to say, we know that this is something that might come up as a challenge in your family, whether it's this year or next year or 10 years from now, and we want to do something that's helpful for you. For that employee, the immediate benefit is peace of mind, because when they're looking at this and they're filling out 5 Wishes, they can instantly see, I see how this could be helpful down the road, hopefully. And they realize that, especially if they haven't had any of these conversations before, that just by filling it out, they've done something really good and they've given peace of mind to their family. So that's the immediate benefit. The additional benefit is that if someone in their family does become seriously ill and decisions need to be made, The actual savings there on the burden is what happens when these decisions are made ahead of time and they don't have to second guess or wonder, which one of their siblings should be the point person or the decision maker. Or if siblings are asked to make a decision about life support treatment for mom or dad, they don't have to start from zero and try to remember conversations that they had 10 years ago. In all of those situations, you're talking about added complication to an already stressful situation. If somebody is sick, seriously ill and near the end of life, it is going to be a stressful time. What we're focused on eliminating is the unnecessary stress, the unnecessary burden of not having some decisions and a plan made in advance. That's what can really tear people apart. And that affects caregiving on the front end for employees who are providing care for a loved one. It also affects bereavement and what happens after a loved one has died. We feel that loss. When my mom died, I felt that loss intensely. I'm so grateful that at the same time, I didn't have to wonder if I did the right thing or deal with the aftermath of family disagreements. And too many families experience that. That's the part that's unnecessary. Mm-hmm. We want to help people do what they want to do, and that is to be the caregiver at the bedside, to provide the love and the care and the compassion and the honoring of the human dignity of that person without being distracted by that unnecessary burden of disagreements and wondering what to do.
That's really beautiful what y'all are doing. So do you have any success stories? Do you have any testimonials that you can share, mainly from the employer side? Like, what are HR benefits teams saying of, I am so glad I brought 5 Wishes to my organization because...
Sure. Yeah. And we, as I mentioned, we've worked with large and small organizations, with mom and pop restaurants to major national airlines and banks and federal agencies that have reached thousands of employees. And the two things, I think employers, number one, they feel like they're doing something good and helpful to their employees that's conveying a message of compassion and that they care about their well-being. And they like that. So they feel good about it. It's the same thing that we hear from doctors and nurses, that in the midst of their challenging, busy day when they have 101 things to do, this is something that when they talk about 5 Wishes with a patient, they feel like they're really making a difference, and that it's kind of why they got into healthcare to begin with. And for a lot of HR professionals, this is kind of why they got into HR, was because they wanted to help people and make it easy for people and make it easy for people to do their jobs well. And sometimes that means helping to eliminate the challenges and the burdens. So those are the success stories that we've heard, are from the HR providers at these large and small organizations who have said, this is the kind of thing that we want to do. And they really appreciate that it's not a huge budget line item and that it doesn't take a lot of work from their office or their team to implement. Those are the things that the employers appreciate. And then the employees are grateful because this isn't something that they expect that their employer would have to do. They recognize that, wow, this is kind of above and beyond. This is above and beyond the standard health insurance benefit. And so they really appreciate that. Now, on the other side of it, on the bottom line also, we know that a ton of money is spent on care in the last 30 days of life. That makes sense, right? People who have serious illness, their care is going to cost the most. And a lot of times, though, that's paying for treatments that a person might not have wanted if they were able to answer for themselves. And advanced directives get to that issue. So when it comes to the finances of healthcare and paying for healthcare, group healthcare plans, we want to make sure that people have access to the healthcare that they want to receive, and also that dollars are not wasted on treatments that a person would choose not to have. And that's very important, that the person would choose not to have. We're not talking about rationing care. That would be wrong. We're not talking about anybody except the person making decisions for themselves to say, this is treatment I would see as valuable. This is treatment that I would see as not being worthwhile or not being worth the burden based on what the benefit provides.
Right. I think I saw some statistic somewhere that says 90% of healthcare costs on a person are in the last 30 days. of life. That's kind of a somber statistic. But let's not end on that. Paul, if somebody wants to get in touch with you about bringing 5 Wishes to their organization, what do they need to do?
Sure. So you can find information on our website. It's 5wishes.org, 5 spelled out, FIVE wishes.org. And our email is there, but you can write to info@5wishes.org to ask specifically about the workplace program. But on that website, you can see the different resources that are available, the 5 Wishes at Work program, where you can get the packet for your employees or the digital version. On that website also, there's an instructional video. It's about a 17-minute presentation that provides all the details to the end user about how to use 5 Wishes. So that's something, it's free. It can be shared with your employees. It can be posted on your, if you have an HR page on your company's website with resources, you can put a direct link to that video and then provide the 5 Wishes to them either in hard copy format or digital format. So 5wishes.org is the destination to get more information.
Well, Paul, thank you so much for joining me on another episode of the Granite List Live.
Thank you, Leigh. It was great to be with you.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.